Mariana Cordier. Welcome to Montgomery Week in Review. Mental health courts are now functioning in Montgomery County, both in the circuit and district courts. Phil Andrews from the State Attorney's Office has the story. Serving Together, a program for veterans in the metropolitan area, now has a new director, and he is joining us today to explain how this rapidly expanding program tries to meet the needs of this group. Michael Ball, a veteran himself, will explain how Serving Together, a program of every mind, can help. November and December are an active time for Manna Food Center, but people in our community continue to need help every month of the year. Stephanie Hubbard is here today to remind us that the winter can be tough for residents in our county. Valentine's Day is all about the heart. The use of care coordination health care providers helps to ensure healthy hearts. Saundra Matthews, Nursing Director at CCI Health and Wellness Practice, will tell us how to help ourselves. So Phil, welcome back to the show. Thank you so much.
Thank you, Mariana. It's great to be here.
So tell us about the mental health courts. What does that mean for the population?
Well, we've needed a mental health court in Montgomery County for a while now because we have seen a big increase in the number of people who commit crimes, particularly low-level crimes, who are booked into the central processing unit and need immediate mental health care. That number has doubled in the last 5 years, from 1,000 to 2,000. So it's a lot of people, and we want to intervene in an effective way so that we can help these individuals get back to a stable, productive life and avoid getting in trouble with the law.
Are there other counties in the state that have a similar program?
There are. Baltimore City has had a program, has had mental health courts now for over a decade, and so has Prince George's County, and Harford County has had one for several years. And so here in Montgomery County, State's Attorney John McCarthy and our Circuit Court Administrative Judge John DeBelius and our District Court Administrative Judge Eugene Wolfe have been instrumental in helping to put this together. So we now have these courts operating in Montgomery County. The Circuit Court Mental Health Court started in December, and the District Court Mental Health Court started earlier this month.
So
and what will
how
be
do
is
the mental health courts help?
well, what happens is that someone who has committed a crime, and typically these crimes are like shoplifting or disorderly conduct or trespassing, will be referred by their attorney, often the public defender, but it could be the prosecutor, it could be a police officer, it could be a family member, for mental health court. And then the mental health court team assesses their suitability for mental health court. They have to agree to participate, and if they're accepted into the program, they have to waive certain confidentiality requirements regarding health care. They have to agree to participate and follow the rules. Take medications, go to meetings, things like that.
How would somebody in a county that doesn't have a special mental health court or a drug court, how would they get that set up? How does that start?
Well, it really requires getting the stakeholders together, but it's crucial. You've got to have the support of the judges because it's a court, so you really need a champion judge, and that was critical here. You also need the support of the state attorney because the state's attorney has to be comfortable with it. The public defender is very involved, and then you're going to need the support services. You're going to need the mental health therapists and the providers in the community. So once you get those folks on board, then I think a community is in a very good position to go forward.
Have you seen a need to connect people with other wraparound services that maybe nonprofits can partner? Because I can see how if you're encouraging people to stay in the community through this process, that you might be identifying other needs that may be unmet for them.
That's right, and often people who are committing a crime because of mental illness may also have a substance disorder or a substance abuse problem, or they might be unemployed, or they might be in lack of suitable housing. So those are needs that you have to address as well, and the mental health court can help do that because the relationships are established between the private providers and the court and the therapists that can help facilitate getting participants in mental health court into those services as soon as they need them, at least while they're in the mental health court.
What kind of crimes are we talking about that will qualify someone?
These are crimes that are typically misdemeanors, like trespassing, disorderly conduct, theft, maybe shoplifting, perhaps assault on a family member, So they're not violent crimes, they're not murders, they're not rapes or armed robberies, but they are, the bulk of the crimes are committed by people who have a mental illness.
And is there a website?
I do want to emphasize that most people who have a mental illness don't commit crimes, but an increasing number of people being booked into the criminal justice system have a mental illness.
Okay,
So-
and I think you mentioned that there's a phone number for the state's attorney's office?
Yes, and we can be reached at 240-777-7300.
And the program is voluntary, though. An individual has to agree to this. It's not
Yes.
that they're the
It's
involuntary
voluntary.
commitments.
That's correct. It's voluntary, and if they don't participate or they're not suitable for it, then they go through the regular criminal justice process.
Are there counselors or anyone that helped them get through this program while they're going through that?
Absolutely. There are case managers and therapists with our Department of Health and Human Services who are experienced and who work closely with them. So, absolutely.
So the population, you say, keeps growing and needing this type of assistance because of the mental health issues. What is the principal goal other than helping them, navigate the process?
Well, the other major goal, in addition to helping them get back on their feet and lead stable, productive lives, is to improve public safety. Because the experience in these mental health courts around the country, and there are over 300 now, is that they reduce recidivism by an average of 20 to 25%, sometimes a lot more. So there's a real public benefit to addressing the cause of the criminal behavior.
And in the studies, have they shown that if you start addressing when there are minor crimes, these people who need the assistance to keep them from escalating?
That's a great point. There's no question that while we're not going to be having people come into the mental health court who have committed homicide or armed robbery, there's no question, I think, that there will be some prevention of escalation of minor to major crimes among this population. So that's a goal too.
Well, thank you so much. I think that's awesome that you guys have started the mental health courts, and I wish you all the best and
Thank you.
success. So Michael Ball, welcome
Hello.
to the show. This is your
Thank
first
you.
time, correct?
It is my first time. Thank you for having me here. Very
It's
happy
great
be
to
here.
have you. So talk to me about this program for veterans that you have.
Okay, Serving Together is a program of Every Mind, formerly the Mental Health Association. And it was formed out of several studies. The onus of this was several studies that were done between 2008 and 2011, which showed that there are a large number of veterans organizations and nonprofits, VSOs, veteran service organizations that are set up to help veterans, but
Yeah, it seems like
many of
there's
them
so
are
many that
Right,
you
they're-
could get confused as to which one you might want or
right.
need. Or
The services are fragmented. Frequently, they're operating in their own information silos, so the organizations themselves don't know what another organization right across the street has been doing, and the veterans are confused as to what's out there and what's available. So the entire purpose of Serving Together is to get these is to improve veterans' access to services by getting these organizations together to work together, and we do that in several ways. We have community and county level collaboratives where we go in and build relationships with veteran service organizations, nonprofits, corporations, government offices that are working with veterans. We try to get everybody around the same table and talking, to network, share information about what they're doing.
And do you have a website or a phone
We
number?
do. It's servingtogetherproject.org.
Can you say it again? That was fast.
Yep, it is Serving Together Project, all one word, servingtogetherproject.org.
So any veteran can go there and
They
have
can.
someone. Do you have counselors or peers to help them through this
We
process?
do, and that's another one of the ways that we are trying to improve veterans' access to services is we have community resources, our website being one of them, and we also have peer navigators. Peer navigators are available. You can contact them on the site. The number is 1-855-738-7176.
Wait, do that again.
1-855-738-7176. Is the number to our peer navigators, and we have them in Maryland and Northern Virginia now. And veterans can call anytime about any veteran-related issue that they're having a problem with, whether it's homelessness, whether it's access to medical or psychological care, whether it's employment-related, post-traumatic stress, anything. We are continually adding to our network of resources and adding to these resources that peer navigators can have. The whole intent is that veterans could call in. We're a one-stop shop. There's rarely going to be one issue. You have a veteran that calls in that's homeless. Frequently there's going to be substance abuse with that also. There's going to be potentially mental health issues, post-traumatic stress. They're going to need help with employment. So
yeah, that's one thing that I think we found to be interesting, and it seems to be something that Montgomery County is really working on, collaborating among agencies. This has been kind of a trend we've been seeing at Manna Food Center as we're looking to bring in all the partners in the food space and interacting with referring agencies, is that we're really so much stronger when we're working together, and this trend across the county I think is making us all more effective at the work that we're doing.
it is, and just getting everyone around the same table and talking can eliminate that duplication of efforts and make everyone's operation so much more effective and so much more efficient. And having,
and you only focus on Montgomery County, or you really?
not at all. We started in Montgomery County, but we have grown. Like I said, we have peer navigators in Montgomery County that serve all of Maryland and DC, and then we have a peer navigator in Northern Virginia as well. We have collaboratives in Montgomery, also in Loudoun County and Fairfax County, Virginia, and if there are already collaboratives in place, which are in some cases out in Frederick.
What do you mean
down
by
in DC.
collaboratives?
Collaborative is just a network of organizations, whether they be nonprofits, veteran service organizations like the traditional VFWs, American Legions, AMVETS, or corporations that have an interest in helping or hiring veterans.
And
Or
how can those corporations and collaborations become a part of the effort?
the corporations, just come out and join a collaborative and talk, hire veterans. One of the things, the state of Virginia itself has an initiative now called Virginia Values Veterans. Part of what they're doing is trying to get corporations to commit to hiring veterans. Helping veterans with their, resumes, helping veterans with their interview skills. Employment is probably, after housing, employment is about the second largest issue that we've seen. It's usually going to be housing or homelessness, employment, and then access to veterans benefits. are
So
some
if
of the
you
biggest
have
issues that we've
about
seen.
15 seconds left, what is the one thing that you really want to leave with our audience that's super important to you about?
Well, we want to be, Serving Together wants to be the organization that brings veterans organizations together, all organizations together in this entire DMV region to serve as a one-stop shop for information and referrals for everything veteran related.
That's awesome. Well, thank you so much, and I hope you'll come back on
Thank
the
you.
show. We have to take a break. Be right back. And we're back. So Stephanie, Manna Food Center, tell me about what you need for the rest of the year.
Yeah. Well, we're starting out the new year, so a lot of times people think, oh, a fresh start, a clean slate. But as you mentioned in the intro, the holiday season is really our busy time where everyone's thinking about philanthropy. They're thinking about ways to give back to the community, and a lot of times they do that through donating to the food bank, which we greatly appreciate. Lots of food drives, lots of people coming in to volunteer. We actually had so many volunteers that we were having to turn people away, families wanting to bring their children in and such. So it's a great time during the holiday season, but then after the new year, when people get back to their routines, a lot of times they're not as inclined to volunteer, and all the food we collected needs to be sorted and checked for expiration dates and prepared in order for us to give it to our 35,000 individuals who access Manna services throughout the year.
It's amazing how many Montgomery County residents rely on this service to be able to eat when the food assistance has already run out towards the end of the month, and so they come and they get help from you.
Definitely. Manna focuses on food distribution, but then we also have nutrition education programs and advocacy work that we do. Because the cost of living is very high in Montgomery County, it takes about $78,000 for a family of three, a working parent with a child in daycare and a child in preschool, to make ends meet. And for a lot of people, that is more than they're able to make. And so that self-sufficiency standard is what it's called, is really the threshold that the human services use throughout the county to determine whether a person is eligible to receive services. And so that's much more generous than the federal poverty rate. But if you look at what the cost of living is here, what your rent is, what you need to pay for child care, it takes a lot to live here, and we want people in Montgomery County who are contributing to our county, who are living here and working here, to be able to live in dignity and be able to have the nutrition that they need to be contributing to our workforce, to be contributing to our...
Do you find that the number of volunteers has dropped off, or the number of food donations, or both? Is it a combination of both?
I don't know. I guess it maybe returns to kind of more of a normal. It definitely is at its peak around the holidays, but once people get into their routines, they're not, maybe they just did a food drive in December, so they're not thinking about collecting food again. Maybe
Is there a
this
phone
spring.
number or a website that people can go to check out what they can do or how to donate?
Definitely. www.mannafood.org is a great way to get all resources, whether you're in need of food and you're looking for a way to refer yourself to receive food support, or you're a nonprofit that has clients that might benefit from food support. There's information on receiving food, but then there's also helpful resources on what types of food we need. You can sign up to volunteer there as well.
Can students volunteer and get student service learning hours?
They can, yes, especially when we have food drives in the community, Giant Food. We also have host tables at farmers markets during the growing season. Those are great SSL hour opportunities. If a student's 17 or older, they can volunteer in our warehouse, which is a good opportunity, especially during the summer. Yeah.
And who is your biggest, food supplier, if you will?
So Manna Food rescues food from most of the grocery stores in Montgomery County. Giant Food is one of our large partners. We're collecting food. Our trucks are out in the community every morning, getting the food that they've pulled off their shelves, because maybe there's a newer prepared sandwich that you might pass up as a consumer, but that's still very great to be consumed for a number of days. And we're able to provide that to our clients with the non-perishable items that are donated from food drives. And we've got perishable items, we've got fresh produce, we have a farm to food bank program where we're actually getting fresh produce directly from local farmers, which is wonderful. And so we're not just providing the canned good that you think of, but the fresh produce.
Do you work with scouts? Both my kids are scouts, so it seems like scout troops would be really interested in coming out and volunteering for that too. Have you reached out to them? And
they're actually one of our largest food drives is Scouting for Food, and if you've received one of the bags on your doorstep and filled it up so that a scout could come pick it up. Also, stamp out hunger in your mailbox.
That's awesome. So thank you so much for coming, and for those at home, please check out their website and see what you can do.
Thank you.
So hello.
Hello.
How are you?
I am wonderful.
Thank you Saundra, for coming on our show. And let's talk about our hearts. I know when I think of February and Valentine's Day, I'm thinking, what am I going to get? Not necessarily about my actual heart.
Well, one great thing about February is that it is National Heart Month. And so the great thing about that is that people get more awareness during this month. We can sort of push having a healthy heart, and it is very important to get the word out there that there is a way that you can prevent heart disease by being healthy and active and eating well. So it's a great time to remind everyone that this is a wonderful month to do that. And also take control of your health in terms of making sure that you know your numbers. And the most important numbers to know are your cholesterol, your weight and height, as well as your blood pressure and your blood pressure and your blood sugar. Those are the most important numbers you should know. And partnering with your providers, your physicians, and your nursing staff, your care team, to make sure that you get pretty much what you need in terms of your health care.
Now, I know, I like to say I'm young, but I'm not. But young people, do they need to care about their heart? I mean, is this something that even strikes
Absolutely. And it's never too young, actually, to live a healthy lifestyle. It's never too young to be active and stay active, do at least 30 minutes of activity every single day. Everyone should do that no matter what. Also, to eat healthy. It's never too young to just look at what you're eating, always looking at your labels, being conscious of what you put in your body in terms of food. So it's never too young to do that. Heart disease actually affects everyone. It affects people no matter your race, your color, and it does affect oldest well as the younger population. You want to make sure that you're always paying attention to your health and staying healthy.
Well, it seems like the American population does have an issue with weight, with obesity, and so if that can trigger heart consequences, I can imagine that that's a very deadly combination.
Absolutely.
That's when people are surprised that Manna has a registered dietitian on our staff, but that's part of the reason is because, you know, we're looking to help people read the labels, as you mentioned, and to increase the amount of fresh produce that we're giving people and requesting low sodium canned good items so that we're not contributing to that.
And it's very important. I think there has been a bigger emphasis on people being healthy and staying healthy, and everyone's culture has those things that's not quite so healthy, but I think working where people are and making sure that we do at least one thing a day that improves your health. Eat one additional vegetable, eating fresh and eating seasonally. It really helps. It makes a difference over time. And
It seems to me that the hardest thing sometimes is dealing with your cholesterol, you know, not knowing, you know, really what the numbers mean.
Well,
the
it's
good
always
cholesterol, the bad
important to have
cholesterol.
those conversations with your health provider, but there are certain things that you can eat that has a good level of cholesterol or a good type of cholesterol, one that actually helps your body metabolize your fats. So there is a good cholesterol and a bad cholesterol, and the important thing is just getting those numbers, knowing those numbers, discussing with your doctor what your targets should be. Everyone's body is a little different, so knowing your target, knowing what's right for you is so important.
How often do you need to get those numbers? Sorry.
At least annually. You should have a checkup at least annually and always talk to your doctor. Some people do need it more, especially based on family history and your current status. So you
Do you
always
have a
need to talk to your
website or a
doctor.
phone number?
Yes, it is cciweb.org. At CCI, we actually have an excellent care coordination program that helps you along the way, in that we give you your numbers. We give you the education. We just don't tell you what you should do, but we work with you and we partner with you to make sure that you know and you are well educated about your health.
And this is serving Montgomery County, or?
Serving Montgomery and Upper Prince George's County.
And
there are very effective medications now for people who need medications to control their cholesterol but can't
Absolutely.
achieve it just through diet.
Absolutely. Not everyone can achieve it just through diet, and that's just a way of prevention and to improve your health. But absolutely, there are medications that do help, and that's why it's so important to talk to your doctor. Having a great relationship with your doctor and your care team is key to making sure that you always know at least what you can do to prevent or promote your health.
right. And so that means I have to give up the chocolates right now.
Well,
Flowers
that's
instead of
hard.
chocolates, right?
Maybe don't eat
maybe
the
the
whole
dozen
box
eggs
on
there.
Valentine's Day. Spread it
one or
out a
two.
little bit.
So if you had any one thing that you really wanted people to know about CCI, what is it that would be?
I just want everyone to know, whether it's CCI or a community center that you can get to, it is so important to, even if you don't feel sick, to make sure you have your annual physical, make sure you're checked and you get your checkups. And no matter what, in Montgomery County, is just like you said, it's sometimes hard because financially it's a very hard county to use your resources on anything other than your living, but you do definitely want to make sure you go see your doctor and take care of your health.
That's the last word, and the last word for the show. Thank you, all of you, for joining me this week, and thank you for joining all of us for this week's edition of Montgomery Week in Review. I'm Mariana Cordier. Please join us next week at this same time.